So my name is Dr. Deltra Mwaki. I'm the nurse scientist at Houston Methodist Sugar Land. So thank you, Jennifer Pazdarmi, for asking me to speak today. I'm a walker and a talker, so I'm going to try to stay back here. But when she asked me to speak, my first thought is like, okay, well, what do you want me to talk about? And so she says nursing research, and I'm like, well, that's really broad. How do I bring it home and make it make sense and meaningful to you all, the content experts on CV? That's not me, that's you. So how do I bring nursing research home and make that interesting? And so the first thing I thought is, okay, well, first of all, maybe I should explain what a nurse scientist is, what that does. So a lot of times people will ask, what do you do? What does that mean? What does that look like? So by nature, I'm an educator. Before coming here, I was a director of undergraduate program at Texas Women's University. So I always have objectives. So for this brief presentation, these are our objectives that I'm hoping that we can kind of work through. So what does a nurse scientist do? I think it's really important that I understand the audience and you all understand me and kind of why I stand here and what the role of a nurse scientist does. A lot of times we think of nursing research as the only thing the nurse scientist does, or when we say science, we automatically go to research. You guys do clinical inquiry and research, quality improvement, evidence-based practice. That's constant through nursing. But a lot of times we put it in this box, and it's not in a box. And so if you look at this figure on the right, these are all the areas that intersect. And what do we call this? Holistic care. And the nurse scientist or nursing research kind of sits in the middle of all of that. But if you look on the other side, these are some of the different things that I do every day. So my role and my scope is broad. So as nurse scientists, we're constantly monitoring what's the pulse of innovation? Where's the future of healthcare going? How can we make what we do better? Why do you do what you do? Is it the right thing to do? Can you do it better? What does the evidence say? What does the literature say? And so we're constantly asking that. We're educating, we're doing classes, we're consulting, mentoring. So the scope is wide of what we're doing every day. But then people ask me, okay, that's great, but what do you really do? Like, how do you operationalize what a nurse scientist is? So here's me. This is what I do. I'm a pictures person, so I'm a mom. I have 4 kids. I'm a wife. I'm an adult geriatric nurse practitioner. I've worked in the operating room, endoscopy, outpatient, inpatient, everything except for no mother, baby, no pregnant women. I have enough kids of my own. So I've done everything else. I am a board member. I serve on the board for Texas Nurses Association District 9. I'm an educator. I'm a caregiver. I've published. I've done research. So I started as a PCA, working in the community, and then just went back to school and got my bachelor's, my master's, and my PhD in nursing science. And so that clinical experience, along with that academic experience, really helps me understand how I can better serve you all, how I can better serve patients. Because the work that you do and the care that you do every day, at the end of the day, we should always be asking ourselves, why? Why do I do that? Is that the best thing to do? Because at any point in time, it could be you laying in that bed. It could be your daughter, your son, your mom. And you would want the person on the other end to always be asking, is this the best care? So in order to understand what you do, I like to take it all the way back, and I like to start with the foundations of how we learn as nurses and how we're trained and what we think. And then how does that tie into clinical inquiry? When I say clinical inquiry, that spans the whole range: quality improvement, evidence-based practice, and research, not just research. In a hospital setting, a lot of times we're doing QI and EBP a lot more frequently than we are research. So that spans the entire range. But I like to take it all the way back. I'm a pictures person. And this is just a sample. May not be your sample, but it's a sample of a nursing degree plan. And when you look at this, it may give you anxiety because you remember what it felt like going through this. But these are the courses that you're taught relatively, right? These are the tasks. These are the things where you learn how to insert Foleys, do IVs, all of those skills. This is what we teach you in nursing school. This is why we teach you this in nursing school, right? Because the NCSBN, who's the National Council of State Boards of Nursing, so all of the state boards of nursing get together, they fall under this NCSBN, and they determine what is important, that the basic bare minimum what nurses need to know to practice. You all know this, but I'm giving you the history. And so this circle right here is kind of where we lie in nursing school, right? This is kind of where all of our courses are built off of and where all of our objectives are built off of. Then you come here. Fresh out of school, GN, hit the floor, and you see this. What is this? The scorecard. Scorecard. It's metrics, right? It's how you're graded, right? How we're graded on the care that we provide. So a lot of times in school, do we show this all the time? We don't show the scorecard, right? We teach the skills, we teach what you're supposed to do, the task, and then when you come, we have the scorecard. We have all of these metrics that you're graded off of. And we ask you to look at these metrics and make improvements, right? So if the number is yellow, if the color is yellow or the color is red, we ask you to make improvements on those numbers. But what does that really mean to you as a nurse? How does the work that you do relate? So all of these metrics, the nursing metrics, the quality indicators, our EOS scores, our turnover rates, patient satisfaction, how does all of this great work, all of the things that you've learned today, how does that really make an impact, and how is that measured? Does this look different to you from what you learn in nursing school and then the scorecard that you're given here when you enter into the workforce? Does it look different? Is it really different? It may look different, but is it really different, the content? It's not. Right? It's the work that you do every single day, all the clinical skills, the care that you provide, the things you've learned in nursing school, and how we're graded, right? The outcome. So the opportunity that we have to understand how all of the things that you've learned, the work that you've done, how we take care of a patient, we have to understand how that interfaces with the metrics that we look at all the time, those scorecards, those outcomes. How does the work that we do actually affect our patient? So we ask why. We talk about shared governance. We talk about shared decision making. What about shared excellence? We don't work in a silo. You don't work in a silo as a nurse. We have support staff, we have respiratory therapists, we work with physicians, we have all of these other disciplines. So the excellence and those patient outcomes for all the reasons why we do stuff, it rests with all of us. So it's our responsibility as nurses to always be asking why. The why is the basis of clinical inquiry. The why is the basis of quality improvement. It's the basis of evidence-based practice and research. Just because we do it, is it right? And so that's where the why lies. You're always going to ask why, and you should always explain why, right? And so when we're educating our patients, why is that important? When we're talking to each other, why is it important? I know my mom used to tell me because I said so. That doesn't always work for everyone, right? And so it's really important for us to explain the why behind it. When we explain the why, that breaks down those barriers in communication, it breaks down those walls, and it really helps us to connect the dots. And that is what clinical inquiry is. And so for me as a nurse scientist, I'm constantly asking why. Is the policy right? Why? Why not? How do we know? Are we doing best practice? Why? Why not? How do we know? If I have nurses come and say, we have a problem and I want to fix this problem because it's not working or it's not giving us the best patient outcome, the process doesn't work, the workflow doesn't work. My next question is why? How do you know? And so you should always be asking that because it is the absolute right thing to do and your patients deserve it. And so when we think about nursing-driven clinical inquiry projects, because we're always encouraging our nurses to share the work that we do. And so a lot of times we do the work and then we think, well, I don't have time to do a project, or I don't have time to write anything or do a poster or submit the abstract, but you do the work every day. You're already doing that. And so you just want to make sure that we're always asking why, and then are we doing these projects in a methodical fashion? So then you can show that this is what we should be doing or this isn't what we should be doing, and how do we change that? And so when we talk about nursing-driven inquiry projects, we want nurses to drive those projects. We can work in interdisciplinary teams, you can work with others, but we really have a voice. And sometimes as nurses, I don't think we do the best at standing on that platform and sharing the work that we do. And we really have that voice. And so when we talk about the difference between quality improvement, evidence-based practice, and research, I just wanted to share this because once again, everyone thinks that a nurse scientist falls in that research bucket. You do quality improvement all the time. What you're doing, how do you make it better? How do we make the process better? Process improvement, quality improvement. Or maybe we're not doing best practice. So you go to the literature and then you look at the literature, you talk to your patients, and you bring all of that together and say, this is what we really should be doing, so let's do this and try it out. Or maybe you look through the literature and there's really no literature out there that addresses the question that you want. So then we need to go and do true research. But it's all clinical inquiry because we're always asking, is this what's best? And so I challenge you to make sure that when you're implementing all of these tasks and all of these things that we learn and all of this innovation, always ask yourself, is it what's best for the patient? So without QI, EBP, and research, once again, they're all intertwined. So you can't have one without the other. So if you have research, but you can't implement it or put it into practice, it's not purposeful. Right? If we have quality improvement and we don't have the research behind it, then we are performing methods that are completely outdated. So they're all intertwined. I often get the question, well, that's great, but I don't know where to start. How do I start on clinical inquiry? Or yes, I want to be more involved with research. Or nursing science seems really cool, but I have no idea where to even find an issue or a problem that I want to fix. I'm sure everybody in here has heard of the daily management system or your huddle board. And that is a perfect place to even start to find a problem. What are you tracking? What needs to be improved? Are we meeting that benchmark or that little scorecard that you've seen? And if not, why, and how do you make a difference? And so a lot of times I think, us as nurses and others, we think of that as a checkbox. Like, okay, yep, we did the huddle board, DMS is done, the colors are there. But that really are the problems that we need to be trying to solve. And so that is a space where you can insert yourself and say, how do I make this better? Because the work that we do, it does drive patient outcomes, and it does drive excellence in our hospital. So through the project planning phase, we want to make sure that you do all of the work up front. A lot of times when we start projects, once you found a problem, and you want to implement or change something, a lot of that work isn't done up front. And so we have nurses that want to start clinical inquiry projects or want to drive excellence, but a lot of the pre-work isn't done. And we all know that it's really important that you get stakeholders on board, people are involved, they understand the purpose before you start the project. And then making sure that it's feasible. Is it something that we can sustain? The impacts of driving quality outcomes. So once we identify a problem and you implement this project, what does it actually do? Why does that quality matter? Why do those outcomes matter? And so the research shows that there are increase in patient safety, there's an increase in staff engagement, there's a decrease in turnover. It really connects you with a purpose, a higher purpose than it just being, well, this is my job, I'm a nurse. It really connects you to that deeper purpose of this makes a difference for the patient. Now, of course, I'm from Sugar Land, so I had to brag on our Sugar Land nurses that are doing clinical inquiry. So we have had several poster and podium presentations at our hospital. These are just to name a few. We've had more since preparing this presentation, but our nurses are really getting involved and getting engaged on how can what I'm doing every day make a difference. And if it's not the right thing to do, or there is an opportunity for improvement, where do I start? And so these are just some of the posters that we've had, and some of the presentations that we've had, as well as we've had some publications as well in some of the journals. So my call and my ask to you all was not to come here and lecture you on CV nursing. You all are the the content experts. My call and ask is to make sure that the work that you do every day, all of that hard work, all the things that you learn, that it is actually making a difference to our patient, or is there something that we could be doing better? And how do we measure that? Are we moving the needle? These are just some references, and if you have any questions, I am more than happy to take them. Y'all are ready to go home?